Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. Today, we're going to be discussing all things residency pursuit. Whether you're in allopathic medicine, osteopathic medicine, or if you're a podiatric medical student, the goal, of course, is to obtain the best residency program possible. My name is Dr. Jeffrey Jensen. I'm the Dean of the Arizona College of Podiatric Medicine and host of the Dean's Chat podcast. I think it's important to note that every year in the academic cycle, we have some really important dates. Of course, graduation's huge, white coat ceremony's huge, board's score release is big, but really the most anticipated day of the year is the match every March, so that students find out where they're going to be doing their residency programs. My guests today, Dr. Randy Cook and Dr. Dale Waxman, represent MD Coaches, and they have put together an incredible program to assist medical students in preparing for residency interviews, hoping for the students to match in the programs of their choice. So welcome to Dean's Chat, Dr. Cook and Dr. Waxman.
Thank you. Good to be here.
It's great to have you. You know, I thought what I'd do is do just a short little bio on each of you before we get talking about MD Coaches and the program. Dr. Dale Waxman is a professor emeritus of family medicine at Atrium Health in Charlotte, North Carolina. For over 30 years, Dale has integrated coaching, well-being education, mind-body medicine, and mindfulness into his practice. He is also the host of the podcast Life-Changing Moments. Dale, is there anything you want to add to that?
No, I think you got that pretty well. That sums it up and kind of where I am today.
Oh, that's fantastic. And Dr. Randy Cook practiced general and vascular surgery for over 4 decades. I've known Randy for many, many years as we've worked together in training doctors and physician assistants and nurses in wound care. Randy, it's great to see you again. You are indeed a Renaissance man. You've got a background in radio, music, traveling, surgery, wound care. You're also the host of the award-winning podcast, Prescription for Success, or RX for Success. Welcome, Randy.
Thank you very much. You're very kind.
Well, I'm so glad to have you here. When I woke up this morning, the first thing I thought is I can't wait to get in and do this interview, because residency placement is near and dear to my heart, because at my school every year, in podiatric medicine, our students are off doing audition rotations or clerkships, if you will, during the 4th year. And many times they do match with those programs. But I'll tell you what, our efforts to prepare them for clerkships and residency interviews is always in process. So I was really excited when Rhonda told me you had this new program, and I was hoping we could talk about it a little more. But before we do that, let's talk about MD Coaches. Randy, I know you've been involved for about 4 years with MD Coaches. In fact, I remember when you kicked it off. What is MD Coaches, and what's the mission? What are we trying to accomplish here?
Well, I can't even begin to talk about MD Coaches without talking about our founder, Rhonda Crow, who is actually a nurse by her original training, but she also got into coaching quite a number of years back. And so just to really go to the origin story, I was on my way home from work one evening. It's about a 30-minute drive for me, or it was at the time. And my phone rang. It was Rhonda. I hadn't heard from her for a while. We had worked together with a wound care company previously, and I had gone on to other things. But in any case, she called. And to shorten the story, the message was, I'm going to start a company specifically dedicated to offering coaching services for physicians for a lot of reasons. And I would like to publicize that with a podcast. And I know that you have a history in radio. So that was the hook. You know, she called me and said that she would like for me to host a podcast, which eventually became RX for Success. And I was really happy to do that. It sort of took me back to the olden days when I was a radio guy. And then to finish the conversation, she said, "Oh, by the way, I'd like for you to get trained as a coach as well."
Oh, very good.
So I guess that was the beginning, to my knowledge, I was the first person that she approached to become a member of the coaching team. And of course, there's plenty of history to follow. There has been the addition of several other coaches, one of which is Dale, who has great experience. But that was the origin of MD Coaches, and it was because of it was Rhonda's vision to provide guidance to physicians, primarily physicians, but actually all healthcare professionals, because of the incredible seismic shift that was underway in healthcare and continues to be underway. And it has really changed the landscape and made survival in the healthcare delivery world significantly more challenging. And she recognized, to her credit, that there are a lot of people in our world that could use some advice from more experienced people. So that was the beginning of the story, and that is how we have continued to maintain it.
Oh, that's fantastic. Dale, how did you get involved with MD Coaches?
Well, it started with me being a guest on Randy's show, and I guess I must have said something that invited them to think that I could do something with the rest of the company a few months later. And that's how I got involved. I was asked by Rhonda to join the team about maybe they were into it about two and a half years. And so I've been with them about that long since as well.
That's great. You know,
let me add, he's being a little, he's sort of underselling himself. He is an experienced coach of many years. And I think that undoubtedly led into the decision to invite him onto the team.
You know, that segues into the first question I was wondering. How does one become a coach? What does becoming a coach look like? And what does the training for that look like?
Yeah, great question. So it's a little bit complex, but there are training programs that enable somebody to learn this system of being with people, which is not therapy, and it's not really even advice. It's really about partnering with somebody to allow them to be their best self possible. Sometimes people get a little off track from what they see as their actual self or what their vision for their self is. And coaching is a partnership. It's a conversation. It's a thought partner to assist people with either getting back on track or enhancing their vision of themselves as well. So the training is usually several months to a year plus, depending on what level of certification one wants for coaching. Coaching is not a licensed issue yet, but there is certification through something called the International Coaching Federation, and that's ICF. The ICF actually accredits coaching training programs. Not all coaching training programs are accredited, and they are accredited through knowing that each of those programs are adhering to some pretty stringent criteria for what are the competencies that a coach will walk out of their training program with. So anywhere from a few months to about a year of coaching training, and then ongoing continuing education like every other profession that we're in as well.
Sure, that makes sense. What is your typical client? And I don't know if that's even a fair question. And everybody has their own unique situations, but what is the demographic that you're looking at typically?
Sure. So we generally get a client from one of three categories, especially in healthcare. One, and probably the most predominant, is clinicians who have, for one reason or another, found themselves embroiled in a landscape of healthcare that Randy just talked about that doesn't quite fit their expectations, or indeed is very different than what they intended when they got into this, and just as a result of the way that healthcare has changed. And so they are usually either disillusioned, unhappy, dissatisfied, wondering how they got here, wondering what they should be doing in life. They've just invested a lot. I'll use the burnout words. A lot of them are burnt out as well, but a lot of them are just on the way to burnout. They're not quite there yet. So that's one category. A second category, increasingly with this change in landscape, is that healthcare systems are bringing physicians into leadership positions, right, which is a good idea, and we support that idea. But physicians often don't have any skill in becoming leaders. They may be great clinicians, great academicians, great teachers, and they often get put into leadership positions for those reasons. But those aren't really leadership skills. And so we'll do leadership coaching. And then the third category is remedial. And what I mean by remedial is it's basically professionalism issues. So we will get clients who have been gotten some low scores on professionalism, or they've been uncivil to their partners, and they're getting threatened with, you're going to lose your job if you don't manage that in some way. And so we'll work with those folks as well. Those are the three biggest categories, I would say.
That makes sense to me. I can see the burnout category. I mean, I think the straw that broke the camel's back was electronic medical records.
Absolutely.
A good friend of mine was in a clinic, and while he saw 2,000 hours worth of patients, he put in an additional 680 hours on his computer just doing charting.
Yeah, I think Randy is nodding his head because a whole lot of his guests are repeating that same story, and a lot of us have experienced that as well. And just a few years ago, I haven't seen the most recent data, but the number one stressor for physicians was electronic health record across the board.
And, Jeff, if I may, I'm going to add a little aside to that story. I was just an absolutely rabid proponent of the electronic medical record back before it became a thing, because it appeared to me that it really had a tremendous amount of potential and could be an incredible time saver. It could be a tremendous augmenting factor in terms of patient safety and lots of other good things. And unfortunately, as a result of good intentions, and I forget what year it was, but during Obama's first term in office, his first project included quite a number of things, but one of those was to mandate that all healthcare institutions that were getting funds from Medicare were going to have an electronic medical record in place by a particular date. And if not, they were going to be penalized. And that was absolutely a worthy goal. But the problem was it shifted the advantage to the makers of electronic healthcare records. And they didn't do a very good job. They gave us a number of products that were far too work intensive, gave very little feedback to the user, created much more stress for the physician than dictating a discharge summary ever could. And we had no way to stop it because the die had been cast. So we were forced into using a product that was poorly designed rather than waiting around for the developers to come up with something that physicians and nurses and other healthcare professionals could say, yeah, that's it. That's exactly what we want. We had no voice in it. And I think that's at the crux of why it's such a backbreaking issue at this point.
Oh, I agree. We're implementing Epic now throughout the university system, and it's moving heaven and earth to make that happen. With all the clinicians and all the transition between programs and things. So I can see that for sure. I think one of the neatest things about MD Coaches is that you're reaching out and you're meeting the needs of doctors at different stages of their career. I mean, like you said, the remedial is one thing, the leadership's another. Let's talk about your new initiative for fourth-year medical students, looking at coaching them up and getting them to advocate for themselves and really set the stage for them to be their best self when they're interviewing for residency positions. The floor is yours. I'm really interested in hearing more about this.
Sure, I'd be happy to share. Similar to Randy sharing the background of MD Coaches, I want to share the background of how we arrived here. We had on Randy's show a couple of guests from an organization called the American Society of Physicians, and those two individuals were officers of that organization. That organization was founded when a whole bunch of medical school, 8 medical school graduates who did not secure postgraduate training, sometimes on a repeated basis, came together to support one another. And then also recognizing that this isn't just about us getting into postgraduate training, but it's also about recognizing that there is a provider shortage in this country. And that's what brought them together to form this organization. Most of the people who are part of that organization are also medical school graduates who have not secured postgraduate training, or maybe since then they have. But it raised awareness for us at MD Coaches. And I was in academics. I didn't even realize the number of people out there who have graduated medical school who have not gotten residency training. It's upwards of 8,000, and apparently it's about 10,000 per year are released into our environment. And the reason for that, by the way, is that there's been growth of medical schools, but not a growth of postgraduate training. And so they become very, very competitive to get in there. And so, but I mean, there's a lot of people walking around who've gone through lots of training, are well-trained, are primed to be helping our country, fellow citizens in whatever way they can, and they can't do it. And so that organization asked us to put together some resources for some of the members who are continuing to try to access postgraduate training. So we actually, we started this by piloting a group coaching program, and I'll say a little bit about that in just a minute, how that's different from individual coaching. And so we did a group coaching program for their members who had just tried to get in last year's match, but did not secure a position in the match. And so following the match, we did 4 sessions of group coaching with a group of 15 of their members around what's next for you. And again, we're not there to tell them what to do. We're not giving advice, but we facilitate a process in that group about what's important for you. What value do you see yourself bringing, and how do you want to do that? And whether that's going on and getting back into the match process again, or expressing that in some other way, we're here to help support you do that. That was very successful. We got a lot of great feedback from those individuals, and the organization asked us to create even more group coaching. So what we've done as a group is we now have 4 different modules, if you will, of group coaching for medical students. And it's all centered around identifying the value that you bring to the profession. So we've timed this around the match, actually. So in the summer, when people are beginning to get prepared for interviews and they're starting to write their letters and get things together, is to really identify and figure out a way to express the value that they individually bring to the world. And then getting prepared for interview season, we actually have group coaching around how do you continue to bring that forward in an interview situation? How do you continue to sell yourself, if you will? How do you do that in a very authentic and genuine way, and not do it in an inauthentic way? And then there is, while you're waiting for the match results, how do you deal with the anxiety, and how do you deal with what else is going on in your head about what am I going to do if I don't match? What if I don't get that position, to explore what are some other possibilities? And then finally, after the match, if people don't match, then they had the opportunity to meet with us through that process of what's next for me. But the centerpiece of all of this is highlighting one's unique value in all of this and maintaining that. People, when they don't match, they feel, as you can imagine, feel very rejected, very, 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 very low, very depressed. And yet these are very intelligent people, very skilled to have gotten to the place that they have. So we at MD Coaches are there to help them re-recognize the strengths that they have and the power that they have and the value that they bring to the world, and for them to recapture that and to sell that to the rest of the world. They may end up doing something not clinical medicine, but they might choose to go in that direction still. So that's our program for group coaching for medical students.
Wow, that is fabulous. I've seen students that when they fail a boards part 1 or 2, it's a hit to their self-image. But probably the biggest hit to the self-image is a student that does not match after putting in so much work and so much effort, and they've passed the courses, but they didn't match for a program. What a wonderful positioning of this program. Congratulations on that.
Yeah, thank you. Thank you.
How did that come about anyway? I mean, this group, I realize the American Society of Physicians, but how'd they find you?
Randy may know the answer to that because I don't know the answer to that.
It's brilliant.
I can't be terribly precise, but I will tell you that somehow our CEO, Rhonda Crow, heard about American Society of Physicians, Dr. Khalif and Dr. Sani, and she thought that it sounded like a pretty good story. So she talked to me about putting them on the podcast on RX for Success. So that's what we did. I wish I could give you the episode number because it's kind of an interesting conversation, I thought. But in any case, we talked about all those things that you just heard. They'll go over in detail. We heard that story from 2 people who had experienced it themselves and who had decided that where there is one, there is likely to be many. And they had the fortitude to put together an organization to provide help for exactly those people. And clearly, because of the success of their organization, number one, they proved that there is a need. And number 2, they have proven that they are very good at what they do because they have had considerable success. And we at MD Coaches are honored to be a part of that if we can contribute in any way.
Sure. I have a question for you. So if 8,000 to 10,000 medical students a year aren't matching, I mean, they may be from the Caribbean medical schools, MDs, DOs, when you go through a program and then they reapply, what percentage of those students end up actually getting a residency program? Do you know that?
I don't know that. Do you know that, Randy? I don't.
I don't know the number. Mohammed and Hannah spoke about that on the podcast. So I know the numbers exist, but I do not have it in my head.
Okay, no problem. There's a lot of downstream problems with not matching, not to mention financially. A lot of these students have taken a lot of loans to go through medical school.
Unbelievable. I mean, it's profoundly expensive. Everybody knows that. And to have accumulated that sort of debt and not be able to find a job that you're perfectly qualified to do is just, I think we can all empathize with that. I mean, what it's hard to imagine more difficult circumstances.
Yeah, just devastating. I can speak for podiatric medicine. I'm on the balance committee to ensure that we have enough residency programs, first-year entry-level positions, to match or exceed the number of graduates from our colleges. And there's been times in as recent as 10 or 12 years ago where that pendulum went the other way and we had more students than we had residency programs. And I saw firsthand the devastation and the hits to the self-image and trying to, pull themselves up by the bootstraps and go through it again the following year is very, very hard.
Yeah. And if I could just to try to plug the coaching services a little bit more, and I'm going to unabashedly do it with a rather personal story. A person may wonder how you can be qualified for a position, how you can be qualified for a job, and everything looks good on paper, but yet somebody is standing at the door. It's the interview person, and how is it that can come about? And I can tell you that I was rejected on my first application to medical school, and reflecting on that, of course, it was devastating at the time, and being in a position more than half a century later where I can reflect on where I went wrong, it was the interview process. My grades were good, and I dressed nice, and I was clean when I went in. Those kind of things. I put on a good appearance, but I didn't interview well, and the reason for that was I tried very hard to give responses to my interviewers that I thought they would like, that they would be impressed by, that they would somehow find to be the right answers to somebody that went to medical school. And clearly I failed at that. And interestingly, at my second application, on my second interview, I did precisely the opposite. And what pushed me to do that, and this is going to get really personal here, I was working as a research assistant during that gap year by somebody that was doing cancer research at the University of Alabama School of Medicine. And he actually went to the chairman of the admissions committee and told him that he didn't think I was medical school material. So a couple of months later, I had gone back to the chairman of admissions office to talk to him about next steps. And in that conversation, I realized what had happened, that this guy had tried to sabotage me. And I looked at him and I said, Dr. Hoffman, look, I understand this other pathologist's feelings about my capabilities as a medical student. And I will agree that I'm not a guy that's going to be a pathologist. I'm not going to be a cancer researcher. But this is what I intend to do with my life. And, if I get turned down this time, I'll be back again. So anyway, I got another interview, and you get interviewed by 3 different people, and it was a completely different process. Instead of trying to tell them what I thought they wanted to hear, I told them why I was there and what my intentions were. And it worked. And I was accepted immediately. And had I been coached into that frame of mind ahead of time, I might have gotten in a year earlier.
Absolutely.
On the other hand, I would have missed out on a year of just incredible experience in the cardiovascular ICU at University Hospital in Birmingham that benefited me the rest of my life. So it all worked out very well.
I can see that. You're an optimist, Randy. Just further testimony that perseverance and grit will take you anywhere you want to go. I love the statement you said, if I don't get in this year, I'll be back next year. That just tells it all right there. Congratulations. Dale, your thoughts on the interview process? Because that mindset of getting in the right position to share your story starts early in the process, like with the statement, the personal statement's part of the first part of your course, and getting in that mindset's part of that, right?
Randy's story is illustrative of what we hear so very often. I still hear it in some coaching of people who are looking for new positions, and they're still thinking, I need to say what they need to hear. And yet the truth is that people, what they really want is, who is this person in front of me? Who is this authentic individual? And it may not be a good fit, and that's okay. It's not a good fit for either one. And so I just want to echo Randy's language around refraining from trying to guess what they want to hear. What they want is, who is this person who's in front of me? authentically, who is this person who's in front of me?
Yep. It makes sense because, when somebody signs in for a residency program in our profession, it's 3 years and you're working together for 3 years and you want to know that person you're working with. They represent you throughout the community and the hospital, and you're doing surgery with them every day. So it really does make sense.
The other sorry to interrupt. The other side of that, you probably have been on the other side of. You've been an interviewer, and you can tell when somebody's answering questions that you want to hear. I mean, you just so we know that the interviewers know that they know it, and they sometimes kind of politely smile to themselves. They're saying what I want to hear.
And I think they find it a little insulting that you think you can put something over on them.
Right. Well, it's hard to hide passion, right? If someone's passionate and they're telling their story, it just seethes out of them. And
right.
I think that's important too. So how do we help get this program out to more people? Well, what's the plan? How can I help?
Sure. So the first thing is you can get some more information at our MD Coaches website. And the best place to do that is at www.mdcoaches.store. And actually, our next cohort begins October 17th and goes through November the 5th. We meet group coaching on Sunday evenings. It's for an hour and a half. I can let you know the price is $475 for that for each cohort. That's about $95 a session. If they are a member of ASP, the American Society of Physicians, it's there's a discount for that as well, and you can find that on that website too.
Okay, that's excellent. And you know what? I can put all of this information into our show notes too. So
great.
I will do that.
And I would like to offer one other thought. The American Society of Physicians, which was put together by Dr. Khalif and Dr. Sani, was constructed because the two of them were so aware of how many people wind up without matches, in spite of the fact that there are many match positions that are left open. And I think a lot of the people that might be attracted to the particular service that we're talking about will indeed be people who have failed to match. But what I would like to put out there is, why not go ahead and get ahead of the game and get some coaching before you ever go into the match?
Absolutely.
That's, I think that would be my goal if I could go back and start all over again.
Yeah, Randy, I was thinking about that on the drive over today. Even taking it a step further than that, a lot of our students are actually interviewing on their clerkships and their audition rotations. And maybe it'd be good for them to have this self-awareness and the skill set in their third year, so that when they're doing some of these audition rotations in their fourth year, they represent themselves well. I think there's a lot of room here, a lot of room to help people. So I commend you all for what you're doing. Congratulations. And I will do everything I can to get the awareness out there. Can we shift gears a second? I want to talk to you guys about some other things.
Sure.
So it's not often I get to sit on a Zoom call with two other podcasters, and Randy, you had a natural knack for this from the beginning, because I was on your show a few years ago.
You were guest number one, my friend. You were the top of the list.
Well, I think that was because I was willing to be a guinea pig, but yeah, we'll run with that. But and then, Dale, you started Life-Changing Moments, and I just think it's brilliant because you're never, ever going to run out of material with guests. Let's talk about podcasting for a minute. How have the 4 years been, Randy? How has it affected you?
I can't think of a better thing that could have happened to me. I decided to end my practice of medicine without any particular plan in mind with what I was going to do with my time. And I think we are all aware of how dangerous that can be. another little personal story. At the time that I decided to close my practice and get out of medicine, as you might guess, I had a little conversation with my financial advisor, and it's very interesting. I walked into his office and I announced, "Hey, I'm retiring, and it's 6 weeks away, and we just, we need to talk about what the plan is." And his eyes got kind of wide, and he got very serious. He said, "Well, now listen, I want to talk to you about something that is very important, and you listen to me very carefully." He said, "You need to find yourself something to do." He said, "I've been in the financial planning business for almost as long as you've been practicing medicine, and I have found that when people retire from medicine, if they don't have something to immediately engage and put their time to some kind of use, you'd be surprised how many of those people are dead within a year, couple of years." And he said those people, on the other hand, that embrace something else and make themselves busy and have some kind of purpose, the great majority of them live many, many years. So, Rhonda did me a big favor.
Oh, Rhonda's wonderful.
And I'm grateful for that.
And you've given back so much. I mean, your podcasts are phenomenal. So that's awesome. Dale, how about yourself? I mean, you're more recent to doing podcasting, and I know you've merged, it sounds like, with an MD Coaches, but I just love your topic. I mean, how'd you come up with life-changing moments?
Well, thank you. First of all, I'm continuing to add to Randy's purpose because he's mentoring me in how to be a podcast coach.
There you go.
So not only is he a podcast coach, he's a mentor for podcast coach. It gives him more purpose. So this is actually an outgrowth of our X for Success. We were hearing in those stories that Randy elicits so effectively. And those stories are the path into medicine and the contributions that people are making. And in many of the stories, we hear these moments, I call them branch points or inflection points in people's lives, where they had this opportunity to go in one direction or another, or several different directions. And that's actually what happens in coaching. People come to us and they're at a branch point. And so we thought one of the ways to get people another way of a feel for what coaching might be like is for me to go back and deconstruct those branch points that people had in their life, those life-changing moments. And when I walk them through, you're at this point, how did you decide to go here? How did you decide to go there? And it's a reversal of what we do in coaching. Of course, in coaching, we take people time A and we help them get to time B. This is going in reverse to understand it. And so it's been, these are all things that allow us to expand on those decisions that people made, all the way from having something that was tremendously life-changing, as like a physical malady that made them unable to actually practice medicine anymore. And they have to that's a significant life change. Or people who read an article and that totally shifted their career trajectory. And what we want to do is make that available to potential listeners who may be experiencing something similar and wondering, I kind of have this pull to go in this other direction, but that just doesn't feel conventional or like something that I can do. These are inspiring stories that may be helpful to those individuals that are in that place where they're teetering on trying to decide what to do next. So that's how we came up with it, because it maps kind of to what coaching is all about too. And for me, it's been, just to answer your question, it's been joyful. It's been a learning process for sure, to learn all about the ins and outs of recording, and I don't have to do all the major production, but coming up with the introductions, and then the big one was one of my guests actually said, "I loved the podcast that I've heard, but I'd really like you to summarize it at the end. Like, what are the takeaway points?" And so really, I got to go back and listen to this thing and then summarize all the takeaway points. And he was spot on. That's what I get the most feedback about.
Sure.
It's like, thank you for summarizing, but it takes me time to do that, as you can imagine.
Right. It's interesting. What I found is that when I'm actually filming or doing a podcast, when I'm immediately done with it, I'm fairly critical because I'm thinking during it. I'm thinking about what I'm going to ask the guests and things. And then when I go back and listen to it later, it's better than I thought it was. Have you guys found that too?
We have the most talented editor on the planet. And my answer to your question is yes. He makes me sound way better than I expected.
Yep.
That's my experience as well.
I'm with you. No, that's great. Another question I had, Dale, if you don't mind me asking, you've got a lot of history in mindfulness, and there's no question our students have lots of free-floating anxiety, and it extends from the time they come into the school all the way through that match. Then they get the match in their fourth year. Then they get a few months vacation or a couple months vacation, and then July 1st, bang, they hit it again with residency. So, what about mindfulness? Where does that play in this entire spectrum of the medical journey and the free floating anxiety that is natural when students are learning new things every single day?
Yeah. So there's actually a lot of research, a lot of evidence about mindfulness practice and how it interfaces in our profession. And I will say that the tradition that I learned from is called something called mindfulness-based stress reduction. Mindfulness practice has a lot of benefits. They so named this because this is John Kabat-Zinn's work out of University of Massachusetts. He's probably the most responsible for bringing mindfulness into the American lexicon. Prior to his work and some other people's work, we really didn't have much of an awareness of what mindfulness was about. But this is bringing a lot of traditions from the East and bringing it into the West. John Kabat-Zinn so named it mindfulness-based stress reduction because he created these groups at the time when stress was probably at the highest it had been in history. In the 80s, we were called the generation of stress, and so there's a lot of other benefits, but that's one of the main things that it can do. And so that's one of the reasons why it is so beneficial for those of us in our profession. Mindfulness practice just eases our reaction to the things that we experience. Instead of reaction, we slow our response down to then realize once we have a stimulus that hits us, instead of just automatically reacting, mindfulness allows us to look at that process and go, oh, I have a few different choices of response to this. And it eventually becomes kind of automatic with actual practice. Yep. From an evidence-based perspective, it is one of the only things that has been shown to actually reduce burnout, prevent burnout, and by effect, actually lower attrition rates. Right. So people who do mindfulness practice are less likely to leave medical training or leave medical practice as a result. It's not for everybody. I will tell you that there's some medical schools that saw this evidence and they said, okay, everybody's getting mindfulness training. And not everybody wants it. And that's not, there's everybody, I want to say everybody has their own unique way of managing their way through life. And that's not for everybody. So it works very well for the people who want that to be what they want to do. It does not work at all for the people who don't want to learn this. So some medical schools learn not to mandate this, but to offer it. Offer it to the students who wanted it.
That makes sense. Just a shameless plug. I've been using the Muse headset that looks at different brain waves, and it does your heart rate and things. And I've done it every day for like 5 years. I do 15 minutes a day, and I think I can literally feel my whole body relaxing and my heart rate decreasing when I start doing the right breathing exercises and things. I think there's a real spot for it. And, I, for example, when we do mock interviews, when we are getting our students ready for residency, questions in interviews, I always tell the students, take a deep breath before you answer the question. Just don't shoot from the hip immediately under stress, you know?
Exactly. It's a great example of it. There's a lot of other ways of teaching people how to induce the relaxation response, which is the opposite of the stress response. And that work comes out of the Harvard Mind-Body Institute. The relaxation response, Herbert Benson wrote about this back in the 1970s. He's a Harvard cardiologist. And there's all kinds of great work that comes out of that, in addition to the mindfulness. So exactly what you just said, take a deep breath actually increases parasympathetic tone, which just automatically begins that calming process, which allows people to be more present and be more themselves in the interview process. So absolutely.
Thank you so much. Randy, just a little trip down memory lane. I miss the days when you and I were tag teaming and teaching wound care, and I've always enjoyed spending time. And
those experiences, particularly when we got to be around Bob Warner.
Yep.
Best years of my life.
Yeah, Dr. Warner, what an icon in wound care, Dale. Before there was Google in wound care, there was Dr. Bob Warner. He knew it all. He was he was a mentor of mine, and I'll never forget. One time I was doing one of the normal and abnormal wound healing lectures for the course, and he said, Jeff, just go out and relax. You know more than you think you know. Go for it, And I just so much appreciated his guidance.
Yeah, he was, I think that he gave that advice to a lot of people. It's interesting that faculty that he assembled were not necessarily, in fact, they were rarely professors and professional instructors of any sort. They were people that were good at wound care, and he knew how to take advantage of that.
Yeah, definitely an icon. My wife and I have a scholarship at Barry University in his name to this date. I mean, he had such an impact on my career. I can't verbalize it really.
Yeah, same here.
All right. Any last words? MD coaches, meditation, singing, Randy, music. I'll give you each the last word. Randy.
Well, my goodness, you'd think after being a podcaster for all these years, I would come prepared with a real zinger, and here I am all blank. So I guess the only thing that I'll add is that I really am happy that we got to spend some time together again after all these years. Jeff, I enjoyed it when we worked together. And it's nice to see you again. And we're really grateful that you gave us an opportunity to talk about what we're doing at MD Coaches, because we love it.
Absolutely. I follow you guys all the time, and I'm impressed with your mission, and any way I can help, I will, for sure. And Dale, last words.
Sure. I would just say that those of our MD Coaches, I think, consist of a really talented group of people who have shifted their focus from caring specifically for patients to caring for those who care for patients.
That's great.
And and we really are very committed to that in many different ways.
Oh, what a tremendous need, and you're filling it. That's fabulous. Well, thank you for joining me today. I really appreciate your time and your expertise and your mission. For all of our listeners out there, if you're listening on Spotify or Apple Podcasts or Google Podcasts, please give us a 5-star rating. And if you're watching on YouTube, by all means, become a subscriber. Randy and Dale, this is a tradition on Dean's Chat. I send a Dean's Chat coffee mug to all my guests, so you'll be getting one of those in the mail.
Can't wait.
Yeah, you're not stressed anymore. You probably don't drink as much coffee as you used to, but you'll find something to put in there.
I'll put something in there.
Okay. All right. Cheers, everybody. Bye-bye now.
Thank
Bye-bye.
you.